Do you know what prevents us from dying of excessive blood loss? When an injury or damage occurs, tiny cells in our blood called platelets gather around the wound along with some other proteins and form fibrin clot. This process is called coagulation, and it usually takes up to several minutes to stop us from bleeding. However, Mayo Clinic researchers and colleagues from Massachusetts Institute of Technology have recently discovered a new type of sealing paste which could stop bleeding without having the platelets in our body to coagulate in just 15 seconds. How is this possible? Well, the idea came from a sea creature called barnacle. Barnacles have the ability to attach themselves permanently on a hard substrate like rocks or symbiont like whales, sea snakes, or lobsters. The secret to this is that barnacles emit a type of oil matrix that cleans the surface and repels moisture, then exudes protein that connects them with the molecules of the surface attached. This characteristic of barnacle has caught the eye of researchers as sealing blood tissue has to deal with wet and contaminated conditions from the bleeding. Barnacles, which live in the marine environment, is exactly what the researchers are looking for. Therefore, various experiments were carried out to see if the sealing paste inspired by barnacles could be used in multiple occasions. When the MIT research team analyzed the barnacle glue, they found a unique composition of sticky protein molecules which are suspended in the oil matrix that can repel water and any contaminants on the surface, allowing barnacles to attach firmly on it. The team tried to improve a sticky material they had previously developed with polyalkylic acid embedded with an organic compound called NHS ester and chitosan. NHS ester provides adhesion, making the paste to attach on the surface, while chitosan is a type of sugar that strengthens the material. Next, the researchers froze sheets of this material and ground them into microparticles. Then, the microparticles are suspended into medical-grade silicone oil. After the paste is done, they first tested it on rats. Just as expected from what the barnacles are capable of, the newly developed glue was able to attach on the blood-covered tissue by repelling moisture and other substances and stop bleeding within 15 to 30 seconds even when a gentle pressure was applied. Before the glue inspired by barnacles in 2019, one of the researchers' team developed a type of double-sided tissue tape inspired by spiders. Even in wet conditions, spiders still could capture their prey with a special structure on their web with charged polysaccharides that can absorb water from a surface. With this inspiration, the tape was designed to clear out a small dry patch for it to attach to the surface. The double-sided tissue tape was proof that it could be used to close surgical incisions or attaching medical devices to tissues. When comparing the new glue to the double-sided tissue tape, however, the new glue has one advantage over the tape. While the tape is suitable for flat surfaces like surgery incisions, the glue could be molded to fit irregular wounds and seal it. This is definitely a huge advantage, as there will be less limitation regarding the application of the glue to a certain shape of wound. Although tests are still being carried out to see if the glue could be used on larger wounds, it is clear that the newly developed glue has great potential to be a huge impact to the medical field. Imagine if it's successful. The glue will be a useful tool in treating traumatic injuries and even used in surgeries to help surgeons controlling bleeding.